I hope everyone had a good lunch. It's hard to stay awake after a nice meal sometimes in the afternoon. I will try to speak a little slower. I understand that was a problem last time around, so I'll try to do better. So we heard in some of the questions that were asked a little bit about this topic already of transitions into adulthood. Yeah, there's no translation, there's no interpreter. Yeah, I noticed that as well. I'm doing fine. Should we? What's that? We started early.
Пожалуйста,
Should we
просим
wait a
одеть
minute?
наушники
I don't mind
для
waiting.
максимальной эффективности
Okay.
презентации.
We're good? We have translation is back? Great. Okay. So you missed all of my great jokes. No, I will try to speak slower, and as I was starting to say,
Nathan,
We're still
please,
not-
few minutes.
oh,
Translate
I
it
thought
again.
someone said we were back. Okay. I'm going to sit down. Someone tell me when to start. Someone, you say okay, but I'm waiting for him to say okay.
Nathan, please.
Ready to start?
Yes.
All right, one more time, we'll try this again. We're good to start? Can everybody understand? Nodding? We're good, okay. Good, I apologize for that. So we heard in some of the comments and questions that were asked in the last panel discussion a little bit about this topic already, and I think that is an indicator of just how pressing an issue this is. And we're going to be speaking a little bit about transitions into adulthood and some of the issues that must be addressed. And one of the things that I hope to do a little bit is to just describe a little about how this process is dealt with in the U.S. I want to make it clear that I don't think that the U.S. is doing this perfectly by any means. I think that there are a lot of issues with how this is done, and it's a struggle not just in the U.S. and not just in Kazakhstan, but everywhere. But obviously, I know the most about how this is handled in the U.S., and so I'm happy to share some of the things that have been done there from a policy perspective and some best practices. But I make no claim that those best practices are always followed as they should be. So I can skip through that. So I think it's important to talk about the fact that transitions to adulthood, everyone goes through a transition into adulthood. This is not something that is unique to individuals with autism. And that the first place to start when talking about this topic is to speak about what a successful transition looks like for anyone, not just individuals with autism. That everyone who is making this transition from adolescence into adulthood is considering at least ideas like completing school, employment opportunities, finding employment that is going to provide them with a means of earning an income, but also provide, as Connie was talking about, opportunities for socialization and having a meaningful contribution to their community. Post-secondary education is something that is usually or frequently is considered. Contributing to a household. People were asking questions about, can individuals with autism go on and be married or have relationships with close relationships? And that's, I think, something that is not unique, of course, to individuals with autism. Participation in one's community, and then experiencing those meaningful social relationships. I should say again that it's important for us to note that children with autism become adults with autism. I think, are we having more troubles with the slides? Are we okay? The wrong slides. Oh, so I sounded like I knew everything I was saying. Okay. So as I was saying, children with autism become adults with autism. I mean, we know that this is a lifelong disorder, and that I think rightly so, a lot of emphasis is put on how do we best help children with autism. But I think that emphasis is now starting to raise awareness in many countries that these children go on to become adults, and how do we best support them as they become adults and into adulthood. And so these are some of the things, as I said, that any adolescent who's moving into adulthood and their family need to be considering, and this is not unique to individuals with autism. However, and again, in the States at least, in the US, we know that opportunities for employment after high school are quite limited, tend to be quite limited, as are residential opportunities. The most common situation is that these individuals are living with family members, usually parents, and that even though many individuals with autism who are adults with autism have the skills that they might need academically to be successful in settings like university or college, that often is not possible for them because there are other barriers to their success, even though they could otherwise be effective in that setting. So things like deficits in social skills that make it challenging to navigate some of the expectations that come with post-secondary education. Also, certain adaptive and self-help skills that are necessary to live independently can also get in the way of these opportunities for employment or opportunities for living more independently. And then, as I mentioned before, problem behaviors can be one of the most significant barriers to individuals being able to live alone or to live as independently as they possibly could. And this is something that I frequently hear, is just the extent to which individuals who might otherwise be successful are encountering one or more of these barriers that prevents them from the kinds of opportunities that they might otherwise be able to take advantage of. So again, just speaking a little bit about the systems that are in place in the U.S., there are significant supports available in the education system. So within the education system in the U.S., there are opportunities to receive either in inclusive settings or even in non-inclusive settings, support up to age 21. Most adolescents graduate at 18, but if an individual is receiving special services, that those services are available until they're 21 if they go on to graduate with a different type of a diploma. And so those supports can be significant. And one of the things we hear a lot from parents is that they look at the day of that 21st birthday with a fair amount of dread, that there is this time coming when the amount of support that exists in terms of individuals who are working with their teenage child, the amount of support for the family really is about to drop off a cliff. They just are not going to have those same supports in place anymore, and they're very concerned about how they're going to manage that moving forward. As I say, there are far fewer supports after high school. There are increasingly some opportunities in post-secondary education. Colleges and universities are more and more starting to adopt some supports and putting supports in place for individuals on the spectrum, but not nearly enough, but it is increasing. For those who are not on a track to attend college, there are some supports again in place within communities, but they tend to be scattered, that they're not consistently available. They tend to be focused more towards those with more significant needs, so supports for different types of living situations, or supports for employment, but not a lot for individuals who don't have a lot of cognitive intellectual disability, or who would otherwise be able to be pretty self-sufficient. There are fewer services for those folks unless they're going to college. So one of the things that is important to note, though, is that within the United States, the law that governs services, educational services for individuals with disabilities, requires that transition planning begin for a child, for a student who's receiving special services by the age of 16. And this is something that is mandated. Again, I think it's a good law with good intentions. The degree to which it's followed as consistently as we would like, or the extent to which this is implemented in a meaningful way, it varies quite a bit depending on the setting and in the school system. And so it's not as consistent as one would like. Overall, just some main points to try to make. The first is that we know with good clarity that there are many individuals with autism who can integrate meaningfully into their community, who can work competitively, who can live independently with the right supports in place and with the right transition planning before they become adults. And as a result of that, because of that, it is important for those who are working with children with autism to begin that process of planning for that transition early, and to really target those skills and those needs that will have to be met in order for that transition to be successful. And so I think, again, it's important to remember that the goal of planning for this transition to adulthood are not all that different for individuals with autism in terms of what skills are going to be necessary and what it will require to be successful. The goal is to have these individuals receive opportunities to get the skills that they need to be independent and contribute to their communities. The skills include academics, social skills, language and communication proficiencies, the ability to manage one's routine and adaptive behaviors in that way, skills related to autonomy and self-determination, living independently, employment, and then to function within the community. Again, just some main points that I think have to be emphasized, cannot be overstated. The first is that successful transition planning begins early, that the sooner that this process begins, the better. As soon as there is any indication of kind of what type of setting one might be planning for, what types of opportunities one wants to seek out for an adolescent or what is going to be appropriate for them, this process needs to begin. And then the second is that this must be individualized, that the unique needs, the unique skills, the strengths and areas of weakness that need to be addressed really require that one do this one individual at a time. So I have a continuum here of different possibilities just from a residential perspective. And again, these are the types of opportunities that exist within the U.S. It's not exactly a straight line. I mean, some of these things cluster together, and some of these settings don't necessarily exist are exactly linear. But they range from, as I said, living with family, oftentimes with parents, to living in foster care, fully supported living, so individuals who live in settings like group homes where several individuals who have disabilities or who have autism are supported by 24-hour supervision and care, to partially supported living where there might be a similar type of a setting, but a supervisor or a caregiver will occasionally be there to help, but not necessarily provide constant care, all the way to living entirely independently. From the research, we know that the more independent a child is able to live when they become an adult, in general, the better outcomes, both for the child and for the family. So mothers have reported that both they and their child do better when they live away from home. And I know that this is a difficult decision for a lot of parents because it involves considerable risk. I think, I am a parent, I have kids, my wife and I are very anxious about the day when my children will leave the home. This is not different necessarily for parents of children with autism. Maybe a little more anxiety and a little more stress, but it's the same phenomenon of wanting to make sure that your child is going to be okay. And that doesn't necessarily change, but it's maybe amplified for these parents. And what we know is that those parents who are able to make that transition for themselves and for their child tend to be more satisfied with their child's situation, and that the child tends to do better as well, that they have better outcomes in terms of their own opportunities and their social interactions and so forth. So I think one of the points that has come up a couple of times here as we've met is the idea that there is tremendous heterogeneity within the autism spectrum, and that's why we refer to it as a spectrum. And this heterogeneity has profound implications for how we go about doing transition planning. These are some numbers from the Centers for Disease Control and Prevention in the U.S., and these were the numbers that Dr. Fombone was discussing yesterday a little bit, where there have been some very systematic ways of assessing prevalence of autism within the U.S. These are for the United States overall, and what they show is that about 1/3 of children with autism in the U.S. have no intellectual disability. About 44% have an intellectual disability, and then there's about 1/4 who are on the borderline. But this is pointing out that approximately 1/3 of children have no intellectual disability. These are children who are, with the right experiences, with the right training, with the right interventions, there's no reason to expect that these individuals can't have the academic and other skills that they need to be successful in a relatively independent way. But at the same time, I think it also just represents overall how much variability there is. And again, this slide is trying to get to that point as well. I was speaking to somebody during one of the breaks earlier about how she was saying for a loved one of hers who is a little bit older, is a teenager, that's probably too late to start intervention with this young man. And the point I tried to make to her was, there is tremendous emphasis on intervention for young children, and that makes some sense in that if we can change the trajectory, the developmental trajectory of a child early on, that can really minimize the discrepancies, if any, between themselves and their peers. And that's much harder to do when someone is older. So if you look at this slide, if you look at the beginning, when a child is young, the difference between their abilities and a peers might be relatively small for a 4-year-old or a 3-year-old child who is on the spectrum, both in terms of those who are maybe need little support and those who need a lot of support. But as they age, that gap gets bigger and bigger and can become quite substantial. And so yes, it's very challenging to move an individual from here to here when they're 13, 14, 15 years old perhaps. And so it is not unreasonable to prioritize, to at least some extent, working with young children when those differences can be made up more rapidly, and change that trajectory earlier in the process so that child can go on and be as successful as possible. Having said that, that does not mean that these individuals can't make significant improvement. It does not mean that those individuals can't make sufficient gains. I've seen too many examples of individuals who make significant progress when they're 9, 10, 12, 13, 14, or older. In my own experience, I worked with a 92-year-old woman on the spectrum who we treated for a variety of issues and who made significant progress. Now, had we worked with her when she was 2, likely her outcome would have been very different. But that doesn't mean that the 92-year-old can't make sufficient progress, that her life can't be improved, that she can't become more independent than she was previous to that. And so there's no reason to not work with those individuals. And this is a balance that needs to be struck, I think, both in terms of how centers prioritize their resources, how governments develop policies. And so it is a challenging question. It is a challenging balance to strike between where we prioritize. But I do think that it's important that we recognize that these services are necessary for adolescents and those moving into adulthood, to not neglect them necessarily just so that the focus is exclusively on young children. Although, again, that's an important age group. Again, the other point of this slide is to just demonstrate that this is a wide gap. There's a significant amount of variability here, and people on the spectrum are all along this continuum, and they are going to have very different needs in terms of how we go about planning for transitions for them. And so that's part of why I make this point about individualizing this process, because each individual is going to be very different in terms of what they need. When it comes to planning these transitions, it's important that this be a multidisciplinary approach. Once again, we've talked about this several times over the course of the last day and a half, and this is not any different when it talks about transition planning, that those who typically are involved in the states, and I would advocate at a minimum need to be involved in any setting, would be educators, any other service personnel who are working with the individual, like speech therapists, psychologists, occupational therapists, physical therapists. The parents need to be involved, and this is critically important. I have seen settings where, and again, this happens in the States with some regularity, where parents are there in token only. So they're there because the law says that they need to be there, but they show up to the meeting to discuss goals and plans for their child, and all the plans have already been made, and all the decisions have already been made, and the parents are just there to sign the piece of paper so that everybody can say that they had a transition plan in place. And this is not adequate. This is not appropriate. It's a challenge for parents because they oftentimes feel unable to adequately advocate for their child. They sometimes feel like they're the least expert. They don't have the expertise to make their voices heard. And so it's critically important that parents be given given the impression that their role is critical. While there may be a lot of experts about behavior and academics and autism, these are the experts on this child, and they know more than anyone else when it comes to what is going to be best, and they have the opportunity to prepare to make those decisions about what the priorities are for that child. I have seen many instances where the individual, whenever possible, the individual with autism should be participating in these conversations. When they have the skills to communicate effectively, they should be given the opportunity to have their voice be heard as well as to what it is that they want for their own future. And this is an important part of self-determination that is, again, critical to planning for adulthood. I've mentioned some of the specific skills again, but these can be broken down several ways, but language, social skills, adaptive living, leisure skills are important, as well as academics. When it comes to selecting specific targets for intervention, there's a gentleman in the U.S. that works a lot with adults with autism. His name is Peter Gerhardt, and he uses a very practical approach to selecting targets, especially he mostly works with young men, and so he says when he's thinking about what specific skills do I want to target for a young man that I'm working with, I think about what does this young man need to do to be able to meet girls, right? He uses more colorful language than that. But we'll suffice to say, what does he need to be able to do to meet girls? If I can't cross a street independently, I can't meet girls. If I can't communicate effectively, I can't meet girls. These are the things that matter to other teenage boys, right? And if I can't use those skills, if I can't purchase food at a restaurant, it's going to be hard to date girls. These are many of the different skills that we need to be thinking about. And again, a pretty practical approach, but I think not an unreasonable one. Other things to consider when selecting some of these targets for intervention for this transition planning. The first is, how is this going to change someone's quality of life? And in particular, whose quality of life are we most concerned about? Because I sometimes see the priority being given to changing the quality of life of the teacher, for example. Making things easier for the instructor, making things easier for parents or caseworkers, not necessarily thinking first about what's going to improve the quality of life of the individual. And then lastly, thinking about how easy is this change going to be. Oftentimes there are more things to target than we have time to achieve them in. And that's just being realistic, that there are oftentimes more challenges, more barriers that we need to address than reasonably we'll be able to do in the time that is allotted to address these. And so we have to make some difficult decisions about where are we going to put this time and this energy, because there's only so much to go into this issue, and we need to think of the ways that will produce the biggest impact with the least amount of resources. There are some guides that exist that can be identified. This is just one, and by no means do I think this is necessarily the only or necessarily even the best, but this is one that I've used in the past. I think somebody yesterday presented data from an ABLS, it's a ABLS, Assessment for Basic Learning and Language Skills. Again, that assessment definitely has its issues, and I don't necessarily advocate using that, but the same publisher has developed this, which is an assessment for functional living skills, and it's designed the same way. It uses the same format, but it is very much focused on functional living skills, adaptive skills. It breaks them into 6 domains: basic living skills, home skills, community participation, school, independent living, and vocational skills. And again, if you're not familiar with the way that this publisher lays out some of these materials, they have each of these different skills. Each one of these skills will be represented by a table that looks kind of like this. Again, this is the table for, I think, just the home skills. And each one of these, sorry, can we go back one slide? We go back one. each one of these is then broken down even further into very specific subdomains. Each subdomain then goes down into the specific skill level, and then if we go to the next slide, this is an example of what one skill would look like. And so this is an indicator of all the different skills that might need to be acquired over in order to be successful and as independent as possible. And you can see how it's broken down into different levels that can be scored. And this is just one assessment, one kind of curriculum guide, I would describe it, specifically to teaching functional skills for preparing an individual for transition. Again, there are others that are out there. I don't get any kickbacks from this group or this publisher, but it is just one example of how these kinds of guides are out there, and they exist and can be very useful, specifically just for selecting specific skills. It doesn't tell you a lot about how to teach those skills. This is more about what to teach than how to teach. But again, for those who maybe aren't thinking through, or you have to think through what the next steps might be or what skills might be missing, this is sometimes helpful to spur thought as to what needs to be addressed for an individual. Again, when it comes to prioritizing these skills, I mentioned asking the question about, do we know what it's going to take to produce this change? Usually by the time we're talking about someone who's in adolescence, we've got a pretty good idea about how rapidly they acquire skills, how much time and energy has to go into making these changes take place. But asking ourselves, do we have the time? Are the right skills in place? Do we have the right people with the right expertise to try to establish these skills? And then it's important to identify barriers. Again, some of the barriers to independence include especially deficiencies in self-help skills, and this is one that's been noted in the literature as being particularly problematic. Deficits in activities of daily living, leisure skills. Individuals who don't have a lot of leisure skills, don't have ways to keep themselves actively engaged, can be problematic. And then problem behavior is another. And individuals who engage in disruptive or destructive types of behaviors oftentimes will find that they're in a more limited setting than they would otherwise need, specifically because of those behaviors. One of the experiences I've had, and again, we spoke a little bit about this, is I find that by the time we start talking about transitions into adulthood, many folks have decided that these barriers are concrete, that they cannot really be changed. And I want to emphasize once again that this is not necessarily the case, that even if these are issues that have been long-standing for the individual, especially if a robust intervention has not been previously attempted, that it is still worth making that attempt. And the example that I give here is that, again, of toilet training. I know this has come up a couple of times already, and I debated whether or not to even include some of these slides because I know we just ate lunch and people are not always really excited to talk about toileting. But I included these slides anyway, and it sounds like there may actually be some interest in this topic. And so our group has done a fair amount of work on addressing issues of toileting concerns. And toileting concerns, as I mentioned, can be very profound for the families that we work with who are dealing with these issues. Of course, for the individual, there are issues of stigma. You know, I sometimes say having toileting problems causes stigma probably faster than anything else, right? If you have problems with toileting, you find yourself stigmatized pretty quickly. But of course, there's issues of hygiene and that kind of thing. And then for caregivers, they tell us again that this is, for these parents, this is the biggest issue that dominates their life. And there are significant burdens for them, besides which just being the barrier to independence that it can be. So we've done a couple of studies now on treating toileting concerns, but we had one where we conducted this study with adolescents. So these were all adolescents, many of whom were had pretty significant impairments, and all had a history. This is strictly treating urinary incontinence. They came to us and we started with a baseline where we just took data on how frequently they had continent toileting, and it was none. None of them had any continence prior to starting treatment. And we followed a protocol in which we had a 6-hour appointment, 5 days a week. This was a 2-week intervention. We had these scheduled sits. So every fixed period of time, they would sit on the toilet, and we used fluid loading, which I described earlier. This is the process by which we just provide constant access to preferred drinks. We start out providing constant access. Over the course of the day, we would decrease that. And as long as there was a continent toileting incident, we would immediately deliver a highly preferred item that we identified with a systematic preference assessment. You can see here the schedule that we use. So initially, they would sit for 10 minutes, and then they would have 5 minutes off, and then they would go back and sit for 10 again, and then 5 minutes. but we would go up and down levels depending on their success. These are the data that we will commonly use. These are the kind of data that we use clinically, and you can see that each one of these, the open data points is a trip to sit where there was no urination, but the closed are the ones in which urination occurred, and pretty rapidly, this is one case where within about within about a week, we saw continence where they were going for about 60 minutes between trips, which is something that most parents can live with, right? So if they take their child to the toilet every hour, then they stay dry, that's something that people will consider successful. And then again, what you see is these blue data points are where the child began to just initiate by himself. So with no specific coaching, he began to request trips to the toilet, and he was able to become independent in his toileting in about 8 days. So this is the kind of thing that, again, has a huge impact on this individual and the opportunities that he's going to have in terms of his post-secondary opportunities. Whether he can live independently or not, this is probably one of the biggest barriers. Overall, we saw on the last day of their intervention that they were 82% continent. Treatment lasted on average about 11 days, so not particularly lengthy. And what we also found was that when we did follow-up around 6 months after the intervention, about 75% had maintained those gains. So pretty good maintenance over a longer period, about 9 months. The other thing that we saw was that about 3/4 of those who maintained their continence also established any encopresis was just dealt with on its own. I mentioned this in an earlier talk, that we didn't specifically have to target that for intervention. It was just dealt with. And again, I think this is important because these were adolescents. These were not children who no one had ever tried this before. This was not a group of young children who were going through toilet training for the first time. These were, 11 to 17, 20-year-old kids who people had made a good faith effort at trying to do this, and they were still able to achieve these outcomes. And so I bring this point up mainly to just emphasize that we shouldn't give up or move on or neglect making efforts to make improvements or to break down some of these barriers for these individuals that may otherwise impede their ability to be independent in adulthood. I mentioned earlier we've done similar treatments for encopresis. These are our outcome data. What you'll notice is that the black bar looks pretty good. These are not all adolescents necessarily, but these are individuals who we treated for encopresis specifically, who had already been treated for enuresis and not seen successful resolution of the encopresis. And I mentioned earlier, on average, we averaged about a 1,400% improvement, which just happens to be statistically significant. So speaking just a little bit now about the issues of autonomy and self-determination, which I think, again, it is frequently not easy, but frequently people will take on the role of deciding what's best for an individual with autism. And again, when children are young and when you're talking about parents, that's of course appropriate, and certainly for individuals who lack the cognitive ability to make independent decisions, that's fine. I would argue even for individuals who have pretty significant intellectual disability, there are still opportunities to allow them the types of choices about what matters to them in their life, and to provide them with as many opportunities as possible to access the things that they care about. And so when we talk about autonomy and self-determination, I talk about it in terms of being able to access the reinforcers that are important to someone. And that's just my behavioral terminology coming out. And Connie will laugh at me later. So when we talk about identifying things that are reinforcing, though, sometimes this is very obvious, right? It's pretty obvious when you see that someone spends all of their time and all of their energy attempting to access something. We can be pretty confident that that's a reinforcer for that person. But other times it's more challenging. And so there are several ways in which we think about identifying what matters to somebody. And one of these is what's referred to as the PREMAC principle. This is just the idea that a high probability behavior is likely to be very valuable relative to a low probability behavior, right? So what people tend to do when they have their free time is going to tend to be what's most important to them. And so oftentimes that's one of the most effective ways to identify a preferred activity, and then to use that to encourage more appropriate behavior. So these are some real examples that I'll give you now. This is the actual adults and adolescents that I've worked with over the years, and some examples of where we've used this idea of identifying something that's important to the individual to use it to encourage the types of behavior that we're looking for that will help with transitions. So this was an example. We had a young man, his name was Steve, and he worked at a grocery store. He bagged groceries. He put them in the bags and helped people to their cars with their groceries. But he complained a lot. He didn't seem to like his job very much, and sometimes he would pretend to be sick. And in the home where he worked, where he lived, there were support staff, and they were instructed that if he was sick, he was supposed to be able to stay home. So he was basically skipping work. And when he skipped work, though, he would sit around all day and watch, I don't know if you guys have televangelists, but that's what he would do. He'd watch religious television all day long. That was his preferred thing to do. So it's not hard to figure out what's important to Steve. Steve really likes watching religious television. So setting up a scenario where his caseworker, and I think this was pretty intelligent on her part, his mom or the caseworker would restrict access to those television programs. There was a little lock on the remote that they could block out those shows, and he only was able to access those on days when he worked. And he started going to work just fine. It was not a challenge anymore. So just capitalizing on the naturally occurring preferences to encourage those behaviors that we want to see more of. This is another example. This is a young man that I worked with. This is a young man, we'll call him Jordan, but it's not his real name. He did not go to church. And I live in the southern part of the United States. It was very important to this family that he go to church. And so his preacher from his church would call him and harass him and try to tell him he needs to come to church and bother him, trying to get him to go to church every week. And so I spoke with this preacher, and we had a conversation, and based on our conversation, the preacher made a deal with him that every Sunday he came to church, he would leave him alone for 2 weeks. And you know what? It wasn't necessarily the deal that the parent wanted. The mom wanted him there every Sunday, but we were able to reach this compromise where he was going to church at least once every 3 weeks, and he was able to avoid having this preacher call him and harass him. And again, just capitalizing on what seems to be the natural consequences that are of value to the individual. Sometimes, though, the actual natural reinforcer or the natural consequences are the problem. That in and of itself can become problematic. Individuals who really love fast food and will only eat fast food, and then it becomes a problem with weight gain and nutrition. Things like that can act, the reinforcer becomes the problem. And in those situations, again, you may not have as much control sometimes. And so there are fewer strategies that are possible. One is to use more arbitrary reinforcers and to try to create bias away from that. So sometimes manipulating certain properties of those through things like altering the quality, the quantity, the effort required to obtain that, or in some cases delay, which we talked about earlier. Here's just another set of examples. Again, these are real examples of mostly young men that I've worked with. So we had a young man, we'll call him Jim. He would always argue with the staff in his supported living facility because he could get a reaction out of them. He would start having debates with them and argue with them, and they would always argue back, and he would tell them about how they weren't following the rules and all of these things. And so what we did was we just taught the staff, look, he's clearly doing this to get attention from you. But if they would provide attention for appropriate behavior instead of problem behavior, if he argued, they would ignore him. If he engaged in appropriate conversation, then he would get lots of attention, higher quality attention than he would get for arguing. And by changing the quality, we saw that he stopped arguing with them all the time. We had another young man who would steal food from his roommates. Usually he would steal the food, and then he would take a few bites right as someone came in the room, and they would yell at him and take it away. And so we found that if we gave him larger quantities of food, if he went for longer periods without stealing, then that resolved that issue. The same is true for trying to for changing the amount of effort required. So we had this was actually a young woman who had lived in an old house that was about 8 miles away, and she basically had grown up in this house. She was nonverbal, and they moved to a new home, like I say, about 8 miles away. And at night, when people were sleeping, she would sneak out of the house and walk back to her old house. And they couldn't find her. She wouldn't have shoes on. She's walking through a not particularly great neighborhood. And this became so problematic that she lived with her grandmother, and her grandmother would have to sleep in the same room with her and move the bed in front of the door and had screwed the windows shut because she could get out of the home. And so the strategy here is pretty simple. She's going through all this effort to go to her old home. They just set up a standard schedule that as long as she didn't leave the house, they would take her there twice a week. And as long as she went, they would take her twice a week with no effort. She stopped leaving all the time, and eventually they were able to stop going at all. And then lastly, like I say, changing the delay to some of these reinforcers can be effective. So we had a young man who got really upset, and every time he got upset, his mom would take him to McDonald's, and she'd give him fast food, where he would always get chicken nuggets. And so, the idea here was that if we provided him with something that he preferred right away, immediately, the immediacy of that, as opposed to waiting a while if he engaged in problem behavior, was able to alter that relationship so that he would use appropriate behavior instead of problem behavior. A couple other ways to just increase these. One is what we sometimes call open economies versus closed economies. That is, sometimes you might find that an individual will engage in something to access a preferred outcome, but that outcome might be more or less predictable. So let me give you a good example. We had a young man that we were working with, and we were trying to figure out what would incentivize him, what would he work for, what did he value. And we talked to his parents, and we said, what does this guy like? And they said, well, he really loves video games. He likes to play video games, and that's what he would really work for. And so we set up, he would do a little bit of work. He would work on academics or other things. And we set it up so that if he did a little bit of work, he could play video games for a little while. And it completely didn't work. It was, he was completely uninterested in doing any work at all. So we said, well, that's strange. Maybe we were asking him to do too much. So we had decreased the amount of work that he was supposed to do, hoping that maybe the ratio would be a little better, higher payoff. Still, nothing, no interest. He wasn't willing to do any work for these video games. So we went back to his mother and we said, why is he not doing this work? And then she said, I don't know. He spends all his time at home on video games. Well, that's the problem, right? He would come to our center where we would have him do work, and he had to work to access our old beat-up Nintendo 64, old game system. And he would go home and he had 3 different game systems where he could play all day long to his heart's content. So this was an open economy. He could access it for free. Why do the work when he can get it for free? And so in the States, we sometimes have an expression, why buy the cow when you can get the milk for free? It's sometimes used in a slightly different context, but you get the idea that we see these individuals who are not willing to expend any effort for something that they can get much more easily. The other piece of this is that preferences change. We oftentimes assume because some of these individuals have restricted interests or have a very narrow set of interests or items or activities that they enjoy, that those things are locked in for life, and it's just not the case. We see these things shift over time, and so making assumptions that this is valuable to this person today and is going to remain valuable to them next month, next year, we just see that isn't the case, and oftentimes that's where problems arise without people not being able to access the things that they care about because people have made assumptions about them being constant. So I spoke a little bit earlier about just this idea of there being so much variability or heterogeneity in terms of the skills and aptitudes of individuals with autism, and also with respect to their needs and the size of the gap that can exist. I've spoken primarily at this point about individuals who have pretty significant barriers to being as independent as possible. I want to speak a little bit now about the other group of individuals who are probably more likely or more capable to being independent, but will still need some supports. This is just a quadrant system that I came up with where I tried to lay out some of the 2 main dimensions along which some of these supports that exist within post-secondary education within the states fall. And so I look at the x-axis as how much support is going to be necessary. So individuals who are able to be pretty independent as opposed to require pretty significant support. And then educational systems that are focused more on vocational and those that are focused more on professional or academic opportunities. And again, just looking at some of the opportunities that exist within the U.S. So within a quadrant that is focused on primarily vocational opportunities, but for individuals that will need significant support, there are programs like in the state of Michigan where they have technical schools, where they provide everything from a 6-month to a 3-year trade program for individuals with autism spectrum disorder. They have residential programs for individuals who need to live at the university, but many do not. But they provide supervisory staff for 24 hours, and these are individuals who are able to acquire a trade and be successful through a program such as this. If we look at other programs, there's those that are still requiring pretty significant support, but are more focused on university and college type education, professional and academic programs. Grand Valley State is one that I am familiar with. Again, there are academic accommodations, but separate dormitories for individuals on the spectrum, and they have additional levels of support so that these are individuals who have someone there 24 hours a day who's able to coach them through challenges that might arise with their classes or classmates. There are far more in the U.S. right now programs that are focused on providing services for individuals on the spectrum who are relatively independent, though, and so this is probably the area where the most growth has happened. Programs that exist in just about every state at this point, things like peer mentors, having social skills group or specific social activities for individuals on the spectrum. Many universities now are doing a specific orientation day, so it's pretty common for new college students to go through an orientation, oftentimes with their parents. Several now are doing a specific orientation for students with ASD and their parents for the first semester. There's a lot of campus awareness programs, and as I say, employment and career mentors are being utilized more and more at the university setting for individuals with autism in the States. But this is where I think that there's more work being done, and there definitely needs to be a lot more energy put into those who are in more vocational programs or who are going to need more significant supports, but could still be successful in post-secondary education. So in summary, as I said at the beginning, the transition to adulthood has many challenges, but the outcomes do not have to be poor, that there are many ways in which these outcomes can be improved, but it requires transition planning, and that this transition planning begin early and be individualized. And finally, that it's never too late to address the barriers that may seem to be preventing someone from otherwise being able to be independent, successful, and contributing to their community. So thank you.